Good afternoon. For those of you that have children, I'm pretty sure that there isn't anything you wouldn't do for your children. Pretty sure there's nothing you wouldn't do to keep them safe. You buy them everything you want to make them happy, prepare them for their future now while they're young. But I have a question for you. What would you do if one day all of a sudden you woke up and your child says, "Daddy, I'm sick," or "Mom, I'm sick"? Do you take your child to the doctor? The doctor says, "Well, we really can't figure out what's wrong, so let's run some tests." They would do blood tests, all kinds of tests where they poke needles in your son. And then before you leave, the doctor tells you it'll be about 3 days to get the results back. You're sitting at home at work and you get a phone call from the doctor. Imagine how it would feel if the doctor says, "Sir, ma'am, your son is sick with a virus that has no cure." A lot of people think they know all there is to know about the HIV virus. But really all they know is what they hear on TV, what they hear from their friends, what they see in the news headlines. But really the truth is most people don't really know enough about the HIV virus. Which brings me to the subject of my speech today, which is the annual National HIV Vaccine Awareness Day, which will be held this year on 18 May 2011. Basically, in a nutshell, the day is dedicated to two very important things: the basic information about the HIV virus and what you can do to prevent getting the virus. I would like to talk about some of the basic information. I don't know everything there is to know, but at least if I let you guys know the basics, you'd be a little bit familiar. There are some basic things about HIV that a lot of people should know about. And that is, what is HIV? How do you get HIV? How is the virus transmitted? What are the common symptoms of HIV? Let's briefly go over them. Basics of HIV. The virus attacks the immune system and multiplies itself dramatically once it enters your bloodstream. The virus attacks your white blood cells. Everyone knows that white blood cells create antibodies to help your body fight off infections and sickness. The virus is the main cause of the fatal disease known as AIDS, acquired immune deficiency syndrome. Like I said before, the HIV virus has no known cure. Medical scientists have been working effortlessly over the past 2 decades trying to find a cure, failing every time. Let's get over how do you get HIV. Okay, as you see on the slide presentation, it travels in the bloodstream, it travels in semen, it travels in breast milk, it travels in vaginal fluids, and it travels in rectal mucus. Those are the only 5 known parts of the body that they found HIV to travel through. How is the virus transmitted? Of course, unprotected sex, dirty needles, multi-use needles, drug needles, infected mother to baby through breastfeeding. What that means is if the mother is infected and doesn't know about it and she breastfeeds, it's going to go to her child. And of course, infected blood. Some of the symptoms of HIV, which are the most common symptoms, are purplish black spots around the body, fatigue, very tired, and you cannot overcome the most common of illnesses, which would be the common cold or the common flu. These symptoms may not show for a period of 10 to 12 years after acquiring the virus, but there have been some cases when it has been longer. 1/5 of every American already has the virus, but does not even know that they have it. So that means 2 of you in this room may have the virus and not even know it. Why is HIV and AIDS an issue? According to the World Health Organization, or WHO, there is an estimated 33.3 million worldwide that have the virus. The number of infected individuals that have the virus that are dying are growing dramatically. An estimated 25 people have died from HIV and AIDS since its first reported case worldwide in the early 1980s. The World Health Organization also states the following: the growing number of infected individuals live in poverty-stricken countries. Approximately 22.4 million are from sub-Saharan Africa. 82% of HIV and AIDS infected people live in Africa, and they have little or no access to medical treatment or facilities. It is a pandemic that affects the individual, their families, the communities around them, the nation, and the world. Now let's go over some HIV/AIDS facts. The first reported case of AIDS in the United States was found in gay men in 1981. It was first referred to as GRID, which stands for Gay-Related Immune Deficiency. Homosexuals were once stigmatized with being one of the sources or the main sources of HIV virus and AIDS in the U.S. In early 1981, the CDC updated its high-risk groups to injecting drug users, heterosexuals, Haitians, and mother to child. Despite the growing number of cases in the early 1980s, the government and medical community still knew little about the disease to take any action on. Children that were diagnosed with the virus were banned from attending public schools. Law enforcement started wearing gas masks and gloves during protests in New York. And landlords in New York City were authorized to evict their tenants if they had the HIV virus. And last, Social Security Administration conducted their interviews, which is usually done on a face-to-face basis to see who qualifies for Social Security benefits. For AIDS or HIV infected people, they would do it over the phone for fear of getting infected. Now let's get over what has been done since the early 80s. President Reagan established PEPFAR, President's Emergency Relief Plan for AIDS Relief. The United Kingdom started the first routine testing on donated blood. In 1984, the FDA approved the first antiretroviral drug known as AZT as a treatment for AIDS. The government established laws against the discrimination of HIV-infected persons. The FDA approved the first home sampling HIV test kit. Now we'll go over how much the government has spent on HIV and AIDS. As you can see by the chart, an estimated $27.2 billion since 1982 to present day has been spent on AIDS treatment and research. In July 2010, the White House released the following strategy. The United States will become a place where new HIV infections are rare and when they do occur. Every person, regardless of age, gender, race, or ethnicity, sexual orientation, or socioeconomic circumstance, will have uninterrupted access to high-quality life, extended care, and free from stigma or discrimination. In conclusion, the HIV/AIDS epidemic has quickly spread from a new and unknown disease to a major cause of death worldwide. In the past 2 decades of study and research, it is still a fairly new disease that continues to be one of the leading medical scientists and researchers' #1 goals. According to Dr. Anthony Fauci, the director of National Institute of Allergy and Infectious Disease of the United States, he states that he is optimistic that we will succeed our continued advancement toward a goal of a vaccine to prevent the HIV virus. For now, the best cure for the HIV virus that causes AIDS is knowledge and awareness. If you educate yourself, your family, your friends, and your co-workers on the hard facts about HIV/AIDS, it is only then that they will know that knowledge is the only proven way to prevent further spread of this disease. With knowledge and prevention, you have a better chance of ensuring that you live the rest of your life and your children live the rest of their life free from the risk of contracting what is now said to be the #1 killer disease worldwide.